Imagine for a moment logging into a health app or maybe, your patient portal. Sometimes it's incredibly smooth, intuitive, right? You find exactly what you need, like with ease. Other times, it's a frustrating maze. Clicks, confusing terms, hidden info. It leaves you feeling more stressed, maybe even abandoned, than when you started. The promise of digital health is absolutely enormous, isn't it? It's supposed to make healthcare easier, more accessible, more personalized. I mean, potentially revolutionary. But the reality of its design, well, it can, and often does, fall short of that grand vision. Today, we're taking a deep dive into exactly why that is, and, crucially, what a team of experts discovered about how to fix it.
Yeah, we're drawing from a really fascinating and highly insightful study. It's titled Designing Digital Patient Experiences, the Digital Health Design Framework, published in Applied Ergonomics. What makes this research so compelling is its hands-on approach. The team did these in-depth interviews with 24 professional designers, real people doing this work, and they all shared their real-world, lived experiences creating these digital health solutions. It really gives us an insider's view into the complexities they face every single day.
So our mission in this deep dive is basically to shortcut your way to being genuinely well-informed. We want you to understand the intricate world of digital health design. We're going to uncover the meticulous and yet often surprising processes designers use, plus the unexpected, sometimes overwhelming challenges they face daily, and the smart, strategic approaches they employ to make digital health work better, truly effectively for you, the patient. Okay, so let's start by getting on the same page. What exactly is digital health, or DH? We hear the term thrown around a lot, but what does it really encompass?
Well, the World Health Organization defines a health system pretty broadly. It's all organizations, people, and actions whose primary intent is to promote, restore, or maintain health.
Right.
So digital health solutions are basically the tech tools built to tackle our current health system challenges.
Okay, so like what kind of tools are we talking?
Oh, loads of things. Think about digital health platforms managing your whole health journey, patient portals giving you direct access to your medical records, mobile health apps, tracking fitness or med reminders on your phone, electronic health records, EHRs that pull your history together.
Even just simple online appointment scheduling apps.
Exactly. Even those, they all offer this immense potential, like
Yeah.
dramatically improving access to healthcare info, making it easier for you to get what you need when you need it, and enhancing your ability to self-manage your own health conditions, putting more control in your hands.
It's a remarkable promise, isn't it? These tools seem like they could revolutionize healthcare.
They really do. What's fascinating here, though, is that despite these huge benefits digital health promises, its full potential hasn't been consistently demonstrated, not across the board. In fact, many digital health solutions, well, they struggle to get adopted or to truly improve outcomes.
And the paper says a key reason is design.
Often, yeah. It points to poor interaction design and a less than ideal patient experience. This is where human-centered design, HCD, comes in. It's fundamental.
Okay, HCD, break that down for us.
Basically, it's about putting the human, the person, right at the absolute center of the design process, making sure the system fits how people actually live and work, making it usable, useful, instead of forcing people to adapt to some clunky, inconvenient system.
Right, making it work for people.
Exactly. Fitting seamlessly into their lives, meeting their actual needs, not just ticking boxes for functionality.
That makes so much sense. So what does this all mean for you, the person trying to navigate these apps? You might think, isn't designing a health app just like any other app? Banking, social media.
But the reality, and this study makes it super clear, is far, far more complex. The healthcare sector itself, the source called it significantly conflicted, complex, and adaptive.
Wow. Conflicted, complex, adaptive. That's a lot.
It really is. It's not straightforward. For one, it's highly regulated. Think data security, privacy laws, HIPAA, GDPR. They really limit how health info can be used and shared.
That must add huge
Hundreds.
constraints.
Huge. And then there's just the sheer number of people involved. These solutions aren't just for patients. It's patients, their families, doctors, nurses, specialists, even administrators.
All with different needs, different contexts.
Exactly. From prevention to diagnosis, treatment, long-term care, it's an incredibly dynamic environment. It absolutely demands a deeply collaborative approach. You need many diverse stakeholders talking to each other.
So this raises a really important question then. Can traditional user-centered design, UCD, can it even handle this?
Well, the paper argues it's often inadequate, precisely because of this complexity. Imagine trying to build, a bridge, but The engineers, the builders, the drivers, they all want completely different things from the bridge.
Right. Total misalignment.
It's a bit like that in digital health. The goals aren't always aligned. You've got the tech company wanting profit, the doctor wanting efficiency, and hopefully someone focused on the patient, but
Those goals can clash.
frequently. And this misalignment can lead to divergent approaches, conflicts, even projects just stalling. Designers in healthcare face really distinct challenges compared to other fields, mainly because the users are often vulnerable, sick, stressed, and the contexts are just profoundly complex.
So you need something more rigorous.
Absolutely. More rigorous, evidence-based, and genuinely human-centered design. It's essential to bridge that gap.
Okay, that paints a vivid picture of the complexity. So how do designers even start to navigate this? The study mapped out their actual processes, right? Not just theory.
Exactly. They interviewed 24 designers, different backgrounds, different companies to get that real insider's view. And they found this clear, yet surprisingly iterative framework, a kind of blueprint.
Okay, so tell us about this framework. What did they find?
Well, they identified 8 distinct stages in the process. And these can be grouped into 4 overarching phases.
Like an extended version of other design models, like the double diamond.
Sort of, yeah.
Yeah.
But specifically tailored, adapted for healthcare's unique issues. And it's crucial to remember, this isn't some rigid checklist.
Right, not step 1, step 2, step 3.
No, designers cycle through phases, they jump between stages. It has to be flexible because healthcare is unpredictable.
Okay, let's walk through these phases, starting with phase 1, preparation.
Right.
Laying the groundwork.
Exactly. This phase kicks things off, sets the stage. The first stage here is clarifying project requirements. This often starts when they get a task from a client, internal or external.
And that task could be anything.
Pretty much. From a vague idea, a thought from daily life, to a big vision like improve the patient experience. Or it could be super specific, like design a digital patient sheet.
So the designer's job is to pin that down.
Precisely. They clarify the context, resources, project goals, always keeping regulations and stakeholder interests in mind, right from the start.
And the second stage in preparation.
That's creating a project plan. Interestingly, designers didn't always mention this first off.
Oh.
Yeah, but when they thought about it, they realized how critical it is. This involves building the team, managing time, assigning tasks, choosing methods, setting milestones.
The project management stuff.
Exactly. One designer literally said project management is your best friend. Another stressed needing a holistic plan, knowing how the process was going to be from the get-go.
So everyone's on the same page.
Yep. It gives everyone a shared understanding of the complexity and fosters dialogue. Helps avoid problems later.
Okay, preparation done. Next, phase 2, problem thinking. Getting into the weeds of the problem itself.
This phase is all about really understanding the landscape, digging deep into user experiences. First stage here, conducting desk or field research. Designers use lots of methods: interviews, observations, desk research, literature reviews, co-creation sessions.
Talking to users, watching them, reading up.
Right. To find problems, spot opportunities. Now, opinions varied on exactly when and how much to involve end users, especially patients.
Okay.
But common outputs are identifying pain points, mapping the current patient journey, creating personas. Sometimes, if things aren't super structured, designers rely on their design intuition.
That gut feeling based on experience.
Kind of, but grounded in reality. As one said, we spoke to clinicians to carry things out in reality. It needs that real-world input.
And after the research,
Then comes framing design problems. This is where they synthesize all those insights, distill them down, to uncover the fundamental user needs, clearly define the core problems to solve, and set overarching design goals to guide the solutions.
how do they do that?
Techniques like self-inquiry, team discussions, more co-creation. The goal is to get prioritized problems and unified design goals. Everyone agrees. This is what we're solving. As one participant put it beautifully, our role as designers is to interpret what people say and go beneath the surface. Find the real need.
Now comes the action, right?
Yeah.
Phase 3, problem solving. Making stuff.
This is where creativity really kicks in, yeah. Translating insights into possibilities. First stage, generating design concepts. Designers aim for a range of potential solutions to those defined problems.
Not just one idea.
Ideally, no. It's an iterative process. One designer said you begin by creating concepts, then check, test, and develop them thousands of times.
Wow, thousands.
Maybe a bit of an exaggeration, but it highlights the iteration. Brainstorming, co-creation are key. Then they use things like wireframes and basic layouts to refine concepts. Like one participant said, "We did the wireframes. We have a graphic designer and product designer who designed the app. It's collaborative, hands-on."
Yeah, once they have concepts.
Next crucial stage, evaluating design concepts. Because clients, clinicians, patients, they expect evidence-based, validated ideas, especially in health.
Can't just be a cool idea. Needs proof.
Exactly. Designers might self-evaluate, but more often they bring in end users, experts for usability tests, user tests, validation. The focus is on tangible metrics, continuous testing for improvements, iteration again,
How do they prioritize?
based on value for patients and the value for hospitals. Balancing user benefit and feasibility, and prototypes are key here, making ideas concrete enough to test.
Like mock-ups or interactive demos?
Yep. As one designer stressed, I always do some concept or usability testing on different solutions with caregivers and patients. Continuous feedback loop.
Okay, concepts generated and evaluated. Finally, phase 4, implementation, making it real.
This is all about bringing the design to life, moving from ideas to actual products. First stage, developing design solutions. Here, visual design, the look and feel, and a solid technical foundation are critical. This means coding, maybe hardware development, and lots of back and forth between the UX researcher and the programmer, as one designer put it,
Making sure it works and looks right.
and that it integrates. This stage might involve more evaluation, focusing on technical issues, system integration, making sure it plays nice with existing hospital systems, for instance.
That sounds vital but tricky.
Very. As someone said simply, we have engineers who are going to code the APP. It needs that technical expertise.
And the very last stage.
Making market release and maintenance. So, launching the product. Like one person said, we released the app and then onboarded the patients, then monitoring usage data, seeing how it performs in the real world. Some designers also get involved in the business model.
How it makes money or sustains itself.
Right. But many were frustrated when projects failed later because of a bad business model or supply chain issues.
A disconnect between design and business.
Often, yeah. And sometimes designers just lose track after launch. They don't know what happened with that, as one put it.
So they build it, and then radio silence.
It can happen, which undermines the whole iterative improvement idea.
So looking at the whole process,
Mhm.
what did the study find about how often these phases actually happen in real projects?
Ah, that's really interesting and maybe a bit concerning. Almost all projects included the middle parts, problem thinking and problem solving.
Yeah.
Makes sense, right? Understand the problem, try to solve it.
Yeah, the core design work.
But here's the thing. Only a small fraction of projects, mostly in companies, actually covered all 4 phases.
Really? What got skipped?
Often the initial preparation phase, setting the groundwork, or the final implementation phase, the market release and maintenance,
In academic projects.
even more likely to stop after phase 3. They'd end up with great concepts or prototypes, but fewer actually made it to market.
Why do you think preparation and implementation get overlooked?
The paper suggests a few reasons. Preparation might be handled by project managers in big companies, so designers aren't directly involved. And post-launch. Designers often just aren't part of that phase. Their job is seen as done.
But the study argues all 4 are equally important.
Absolutely. For a truly successful and sustainable solution. Skipping preparation. You risk misaligned goals, wasted effort. Skipping implementation. Even the best design might fail commercially or lack support.
It's a whole chain, and every link matters.
Exactly. Especially if we want digital health to live up to its potential.
Okay, we've got the stages. Now let's talk about the people. Digital health design is super collaborative, you said.
Mhm.
Who are the key players in this complex ecosystem? It's more than just designers and patients, right?
Oh, definitely. It's a varied crowd. The study identified several key groups. First, you've got clients. These are the purchasers, managers from hospitals or businesses, often the decision makers holding the budget.
The ones paying for it.
Pretty much.
Yeah.
Then there are the designers themselves, UX pros, engineers, the people actually building it. Third, domain experts. Crucial group. Medical professionals, policy experts who know the regulations, marketing folks.
People with specific knowledge.
Exactly. And finally, the users. And that group splits into 2. Healthcare providers using the systems to deliver care, and healthcare receivers, the patients getting the care.
And these users are mostly involved in the middle phases.
Typically, yeah. Problem thinking, problem solving. Especially during field work and user testing, their input is vital there.
But here's where it gets really interesting, especially for you, the patient listening. The study found a big split among designers about needing direct patient involvement, like a real disagreement.
A very clear division. Yeah, about 54% argued strongly. Designing for patients is different from designing for healthy people. They insisted direct patient involvement was crucial for user-friendly, empathetic solutions.
Why? What were their concerns?
They worried relying on others, like doctors, could lead to bias. Designing based on what doctors think patients need, not what patients actually need. As one designer put it very bluntly, knowing patients by talking with doctors cannot represent patients' perspectives. Doctors transform all patients into one person.
Wow, that's a strong statement. Keep a distance from the doctor's view.
Well, perhaps not distance, but recognize it as one perspective, not the whole picture.
But almost half the designers felt differently, 46%.
Right. They believed designing for patients wasn't fundamentally different from designing for anyone else. Their argument was often practical. It's hard, ethically complex, time-consuming to directly involve patients, especially vulnerable ones.
So it's easier to talk to others.
More efficient, they argued. Learn about patients from accessible folks like nurses or family members. And for B2B projects selling to hospitals, not patients some felt they already knew enough about patients through internal contacts.
So they didn't need direct patient contact.
That was their view, which, as you said, raises that fundamental question. How do you ensure patient-centered design if there's disagreement on even talking to patients directly?
It's a core tension. Really impacts the final product you might use. Okay, and what about the order of research? Talk to doctors first, then patients. Or the other way around. Does it matter?
Another point of differing opinions. Some felt talking to doctors first was more efficient. Why? Because if patient insights conflict with care team insights later, it can cause delays.
Avoid conflict up front.
Kind of. One designer said, in the past, we saw lots of confusion and conflicts. Then we decided that we would prioritize care teams. Pragmatic, maybe.
But others worried about bias.
Exactly. The starting with the doctor's view could unconsciously shape the whole design direction before hearing the patient's reality. Some felt the order shouldn't matter at all. Just be independent, avoid prejudice.
So what's the recommendation?
The paper suggests it depends on the user's goals, resources. But critically, to minimize bias and get a full picture, designers should rely on multiple sources, not just one perspective. Triangulate the data.
Right. But despite all this, the study concludes something pretty stark. Truly patient-centric design is unlikely in the real world. That sounds pessimistic. What does that mean for us?
It's a profound observation, forces us to look at the system. Why is true patient centricity so hard? The study found clinical outcomes, health metrics, treatment success, and business goals, profit, market share, were often valued more than user experience by decision makers.
So the people signing the checks prioritize other things.
It seems that way often. The system experts and decision makers hold more sway than the direct users, patients, or even providers.
So is the ideal then?
The paper argues for understanding both user reality and clinical reality, meeting the needs of both providers and patients. The goal should be prioritizing patient-user experience equally with process and clinical goals.
A balancing act.
A constant, delicate, challenging balancing act. In a complex system where, the scales can easily tip away from the patient. It's systemic, not necessarily individual fault.
Okay, this complex environment, all these stakeholders, it must create huge hurdles for designers. The study identified specific challenges, right? 12 of them.
12 distinct challenges grouped into 4 categories. Understanding these really helps appreciate the effort involved.
And why some health apps, well, missed the mark.
Exactly. Some challenges are universal to design, others very specific to healthcare. It's a unique landscape.
Let's start with the first category, contextual challenges. Things they face before even starting fieldwork.
Right, foundational hurdles. First is adapting to complexity. Healthcare is just pretty complicated, involving many stakeholders, many subdivided medical treatment scenarios. Diabetes is different from surgery recovery, which is different from mental health.
Requires specialized knowledge.
Tons. About the disease, the tech, the clinical workflows. As one designer said, designing for gardening. You can go do gardening. Designing for a disease needs much more empathy, deeper understanding.
Okay, complexity. What else?
Second is dealing with documentation. Can be overwhelming. Regulatory barriers, ethical components, getting approvals takes ages, lots of effort. Think ethics boards, privacy protocols.
And data security.
Huge concern. Storing patient info securely adds layers of complexity. One designer called writing an ethics protocol painful. It took a long time. It's often unseen but vital work.
And the third contextual challenge.
Attuning to restrictions. Lots of external factors. Tight deadlines, external delays like COVID messing up clinical trials, plus money and time constraints forcing limits on user research.
So they can't always do as much research as they'd like.
Often no. It's tough to avoid overinvesting time, deciding when to move forward with limited resources, a constant juggling act.
Okay, moving on to practical challenges. These are about the actual work in the field.
Exactly. Day-to-day hurdles. Fourth challenge, reaching agreements. With collaborators, designers often mediate conflicts and different points of view between team members, product managers, interaction designers, IT folks, design advisors.
Different disciplines, different priorities.
Yep. And it's hard to get non-designers fully on board with a human-centered approach. Sometimes it feels like just a buzzword to them. One designer highlighted the core struggle. What's best for the patient is quite often not the best for the caregivers or the best for finance.
Oof. Direct conflict.
And often, no one high up is truly representing just the patient's interests.
Fifth practical challenge.
Involving end users and uncovering real needs. Super tough. Time resource limits, privacy issues, sensitive topics. Designers might be unable to or not allowed to contact patients directly.
Especially vulnerable patients.
Especially. They might lack the mental space when ill. Plus, users don't always tell the truth or even don't know their real needs. Makes it hard to dig deep.
And the sixth practical challenge.
Making design decisions, that constant struggle we mentioned, balancing diverse stakeholder needs with real-world practicality. Patient versus caregiver versus finance.
And client profits often win out.
They can have a bigger influence than user needs, sadly. Achieving an equitable user experience is the goal, but it's hard, especially integrating tech seamlessly into daily life. Lots of compromises.
Next up, managerial challenges. About the collaborative atmosphere, interpersonal stuff.
Exactly. Human-to-human hurdles. Seventh is managing relations. Key, but difficult. Designers often give balanced advice, trying to please everyone, which means someone's usually angry or at least unhappy.
Walking the tightrope.
Totally. They face frustrated clients who didn't like our suggestions, skeptical doctors who don't necessarily believe in us or trust their experience over tech. Even IT folks might think designers are doing the wrong thing. It can be an environment of mistrust.
Eighth challenge.
Building understanding. Reaching consensus is hard. There's often a gap, what people say they want and what actually happens in practice.
Saying versus doing.
Right. Plus language and cultural barriers. The same word meant different things to different people. Misunderstandings about prototype or user-centered design itself makes it hard to generalize findings. Constant need for clarification.
And the ninth managerial challenge.
Communicating design value. Constantly needing to justify their work. Designers have to communicate the importance of use-centered design, show your real value.
But that's hard.
Yeah, because they often can't serve 100% of the population or deliver instant, huge results, like bring more surgeons to the hospitals. So they might feel their contribution is seen as just slight improvements.
Not transformative.
Right. So finding a way to tell that story, explaining the research and process, becomes essential to show impact.
Finally, commercial challenges.
Yeah.
Adding business value, making it sustainable.
Yep. 10th challenge. Providing evidence. Doctors, patients, often resistant to new tech unless it's proven to improve things.
Need solid data.
Right. And while early testing is good, actual validation studies can yield horrible results sometimes, even if lab tests look fine. A big hurdle for adoption.
11th challenge.
Implementing solutions. Designers can feel they lose their voice. Success depends on the client. You can't really do anything about it once it's handed over. Plus operational issues, problems with data exchange between systems, limited integration.
Making it inefficient.
Very.
Yeah.
Increases designers' workload trying to bridge gaps, like manually uploading patient profiles because systems don't talk.
And the 12th challenge, the big one.
Establishing business models, the huge unknown. Who will pay for it? Designers have to think about who impacts the final sales, what the budget holders are willing to reimburse. These people sign off.
And user needs can take a backseat.
Sometimes, yeah. When thinking about the business model again, profitability can override patient needs. As one person put it, the biggest unknown for us is how the money is going to come to the company. Plus, navigating complex insurance systems adds another layer of commercial difficulty.
Wow. It's clear these challenges are all tangled up, aren't they? A complex web. One problem makes another worse. So, facing all this, how do designers even cope? What strategies do they use?
Well, the paper frames it nicely. Challenges and opportunities are two faces of the same coin. These strategies aren't just about fixing problems, they're about turning them into chances for better design, leveraging constraints.
Okay, let's hear some of these strategies, the tools in their toolkit.
First, a big one. Embrace a holistic perspective. Start with thorough research literature reviews, market analysis to build context and knowledge before diving in. Understand the big picture first.
Second strategy.
Establish an actionable plan with clear milestones. This tackles those restriction challenges. Better project management, resource coordination, time planning, risk management. A solid roadmap. Foster visionary and strategic design leadership and authority. Empower designers. Ensure they have that systematic, big-picture view. Understand client inputs. Stick to principles. Helps them make better calls. Sometimes just positioning them stakeholders as the experts can really shift dynamics positively. Acknowledge their knowledge.
Fourth strategy sounds crucial.
It is. Promote collaboration and co-creation inclusively and with empathy. This means involving legal ethics teams early for documentation, using empathy, truly trying to be in the patient's position, and leveraging caregivers' family to get insights from vulnerable patients indirectly. Include all voices somehow. Emphasize iteration. Design isn't linear. Allow for continuous improvement. Cycle through stages. Refine constantly based on feedback. Essential in this complex field.
Sixth strategy.
Make designs visualizable, tangible, and testable. Use infographics, prototypes, usability tests, bridges understanding between different disciplines. Making things testable in the early phase provides that crucial evidence of value.
Yeah.
Builds trust. Utilize storytelling techniques. Powerful stuff. Effectively communicate concepts, design value, know how to tell your story, reveal patients' daily lives, engage emotionally, show solutions are much more friendly to use, human impact, not just features.
And eighth.
Prioritize equitable experiences. Design with a systemic view. Consider all perspectives, facilitate discussions on conflicts, strive for inclusive, fair experiences for everyone involved, leave no one behind.
His strategies sound great, really positive, but the paper says they're hard to implement.
They can be. Getting everyone aligned takes time, energy, effort. Even though it leads to more sustainable solutions in the end, it's an investment.
So it's a mix of core design skills and broader abilities.
Exactly. Visualization, prototyping, core design stuff, project management, leadership, broader skills. But underlying many are flexible mindsets, systematic thinking, deep empathy. Crucial for handling complexity, involving stakeholders, building understanding, and visionary leadership somewhere in the mix is essential to champion these strategies.
So pulling this all together, phases, stages, challenges, strategies, what's the main takeaway? The core contribution?
It's this proposed digital health design, or DHD, framework. It's powerful because it gives this comprehensive overview. For each design stage, it maps out deliverables, activities, stakeholders, common challenges, and strategies.
A complete picture for each step.
Right. And it explicitly adds that preparation phase at the start and a robust implementation phase at the end stages, often overlooked. By making these explicit, it empowers designers to manage the process better and ultimately improve the digital patient experience.
And you mentioned it also helps clarify some confusing terms, UX, PEX, digital PEX.
Yeah, that's another useful contribution. They're often used interchangeably, but they're distinct. Think of it like this. UX, user experience, is the broadest. Your overall feeling using any product or service. How easy, pleasant, effective it is. Targets all users, patients, providers, admins.
Okay, UX is broad. What about PEX?
PEX, patient experience, is more specific. Focuses only on patients. It considers their entire journey across the continuum of care. Not just one app interaction, but hospital visits, follow-ups, home management. It's tied to emotional purposes, their well-being throughout, the whole journey feeling.
And digital PEX?
Digital PEX is the digital slice of that, where technology mediates the patient's interaction with the healthcare system. It deals with concrete usage scenarios, how patients use specific digital tools in specific health contexts. It's the digital layer on the PEX journey.
Why does clarifying these terms matter so much for you, the listener?
Because having this shared understanding is vital for everyone working on these projects, designers, doctors, policymakers, business folks. When everyone speaks the same language, it reduces misunderstandings, streamlines work, and most importantly, keeps the focus squarely on the specific needs of patients in the digital health context. Helps align everyone on the true purpose, better health solutions for us all.
Okay, like all good research, the study points out its own limitations too, right? And suggests where to go next.
Absolutely. Transparency is key. One limitation is it's qualitative. Based on interviews, so some challenges or stages might have been missed if people didn't mention them.
A snapshot, not necessarily exhaustive.
Exactly. And some proposed strategies are based on individual experiences, needing more evidence for widespread effectiveness. Acknowledging that is important.
So where do the authors suggest we go from here? What are the big open questions?
They flag several key areas for future research, pushing things forward.
Such as,
First, understanding how designers' own attributes, their background, experience, and project context, company type, location influence their process, challenges, and strategies. More nuance needed there. Second, investigating the time spent on each phase and stage. Does time spent correlate with importance or difficulty? Could guide resource allocation. Third, a deeper dive into the implications of involving or excluding specific stakeholders, especially patients when resources are tight. How do we best ensure patient voice is heard effectively? That's crucial for you. Fourth, identifying steps and criteria for more effective industry design plans, moving from anecdotes to structured, evidence-based project approaches. Fifth, exploring how to involve clients more effectively, reducing their prejudice expectations, fostering shared goals across all stakeholders, aligning business and human needs better, and finally, focusing on exploring and providing evidence for targeted strategies for each specific challenge, moving from what people do to rigorously proving what works best. Actionable, validated solutions.
we've covered a lot. From the huge promise of digital health to the messy, intricate design steps, the tough hurdles, and the smart strategies. This deep dive really shows that effective digital patient experience isn't simple. It's this careful, delicate balance. Human factors, tech, business realities.
It really underscores a fundamental truth, doesn't it? The quality of these digital tools directly impacts our well-being. It's not just about functions, ticking boxes. It's about empathy, deep understanding, robust processes that value the human element.
And for you, the listener, hopefully this offers a new lens, a more informed way to look at your own digital health interactions. Because as this tech becomes even more embedded in our lives, managing conditions, scheduling appointments, it raises a big question, I think. What's our responsibility as users, as stakeholders? Do we just accept what we're given? Or do we actively demand and help foster designs that truly put our human experience, our well-being first, ahead of just functionality or, frankly, just profit? It's a conversation that's definitely going to continue, and we're all part of it. Thank you for joining us on this deep dive.